health care reform? Does anybody need health care? Health insurance? Go, y'all need to make some noise for themselves. Does anybody need health insurance? Does anybody's cousin need health insurance? Is anybody upset that health insurance is so doggone high?
This debate is about whether our country values corporate interests over the interests of the people and humanity at large. Not many have said it straight up, but I will. The way we administer and practice medicine in this country is driven by the desire of rich people to become richer. But you cannot put a price on humanity.
To look for other insurance, but no one would accept her. She had cancer, which to insurance companies is a pre-existing condition. No one would accept her. So here my mother is, went through all these things, no insurance. She was apprehensive about going to the doctor because she said that she thought she was treated differently. She has 4 6-hour treatments, IV in her arm, sitting there, and these processes are prolonged. 3 a.m. in the morning. Once again, my mother didn't have any insurance, so her oncologist from the oncology center had to come to the hospital and sign her in before she could get a room. My mom didn't get put into a room until 12 o'clock. That's 9 hours that they could have done something. That is 9 hours where my mother was dying, and they did not put her into a room until 12 o'clock because she had no insurance. On August the 22nd, at 1:10 p.m., I sat in the room and I watched as the respirator was disconnected from my mother's body. I watched her inhale and I watched her exhale for the very last time. My mom died at the hands of a malicious and heartless healthcare system, but nobody else has to. It is up to us to become educated and cognizant of the harsh realities of what is going on in our healthcare system. Paperwork and processes should never
Do not be scared about healthcare reform. One thing is clear, the stories have been shared, the stories will continue to be shared. But one thing is certain, we need healthcare reform, we need healthcare reform now. And the people who don't want you to have it are simply scared of change.
I never really cared or thought about health insurance. My mother wasn't sick, my aunt wasn't sick at the time, so for me it wasn't a big deal. But now I'm telling you it's a big deal because you never know what's going to happen with your life. Tomorrow you can get sick, and for those of you who don't have health insurance, and for some reason you're no longer at Howard University, you have no other option.
Before you this evening to inform you that silence is no longer an option. There are thousands of people screaming that healthcare reform equates to evil. However, there are more than 40 million people without health insurance. People are saying it's evil, but there are more than 40 million people without health insurance. Healthcare is not a privilege, it's a natural right.
See, it's an option towards achieving the end goal. And sometimes what's been happening is a lot of confusion around the public option. So let me make it real quick. You have 30 million American citizens, about 47 million people in the country right now that don't have health care, right? So it only makes sense that we create an alternative so someone can get health insurance. And a lot of times people can't get health insurance right now because they can't afford it. They don't know where to go. They don't know the opportunities of what to do to actually get it. So we said, let there be a public option. Now, let's also be clear that it's one step, it's one part of this whole reform plan. And sometimes we get caught up in thinking that, well, if there's not a public option, there's not reform. The end goal is still the same. If we give every single person an opportunity to get covered, that's the end goal.